Oh, howdy. So, this is for the hygienist. This is to help you understand the exam sheet. I think patient experience specialists and everybody could look at it too, but really for the dentist and for the dental hygienist. So, this is the what we call the hygiene exam sheet. This is what you will be using to, in 2 seconds, be able to communicate, a whole conversation that a hygienist has had with a patient to the dentist before they walk into the room. Easy one, name. This is where you write the patient's name, the op number that you're in. Sometimes if a patient needs to leave by a certain time, you can write that time here. So if they have to really go and pick up their kid from school or something, they need to leave, 20 minutes early, then you can write that time in here. And then any personal info. This is when, as a hygienist, you have a lot more time to talk with the patient and come to understand and who they are, what's going on in their lives, what Johnny's doing, what Beth is doing, all that type of stuff. And this is a spot to write that down. Good ones to write down are, birthdays next week, getting married in a few months, just anything like that that you can write down to give the doctor a quick in to be able to talk with the patient. This is a great place to be able to write that down. So this name, personal info op, and this is all you can kind of fill out as you see the patient. This is also a very, very big category for me personally because I'm going between different offices. Sometimes I don't know if I've seen that patient or not unless I've really had a, fun experience with them or something like that. But oftentimes, if just routine exams, sometimes I don't remember. I will be completely honest. Once they open their mouth and I see their teeth, then I can see that I remember them. But before that, sometimes I don't. So this is a great place for you to be able to write that. If we know the patient or the family. So once again, if I've seen the mom or dad, but now I'm coming in to see the kid, you could say patient, yes, you can draw an arrow there, or family, no, or that type of thing. So that way, at least if I know the family, that at least I know I can have an indicator of that. One other good thing to write down here is if this is a new patient or a recall. So you can just circle that. And this is a spot where we'll enter in the blood pressure of the patient for that day. That way, if it's high, then we can mention to the patient, hey, it's kind of high blood pressure. Maybe a physician would be good to see, or et cetera, et cetera. So this is a great place for that to be. If a patient during the exam says, I've got this tooth that's really bugging me, or they come in for, they have a toothache, but they're coming in for a cleaning first, this is a great place for you to write down their chief complaint. So this is probably the one item that is from the patient to the doctor that's probably the most important that you want to write down. Here is the chief complaint. There's two spots, so you can write that down here. If they're in between the age of 15 and 30 and they need a thirds consult, you can kind of circle that. Age 10 to 15, they might need to take a look at braces. If the patient's interested in implants, you can write down, circle this right here. How old are their fillings? If their fillings are really old and they, some of the older silver ones that are starting to break down, sometimes it's good to ask the patient, hey, how old are these? Some of these fillings are kind of look like they're breaking down. And the patient might say, I don't know, they're 30, 40 years old. Sometimes it's a good place to write down so that we can help with the patient understand that, sometimes the fillings need to be replaced every 5 to 10 years. So not necessarily always the case, but if something is really bad, it's a good segue for the patient to realize, they need to be replaced. If the patient is a teenager and needs sealants or fluorides, or a kid needs sealants and fluorides, are you able to do those today? This is a spot for you to be able to, as a hygienist, be able to portray to the dentist, they need sealants, they're treatment planned, and we're going to be doing them today. So once again, this is just a quick overview for them to be able to know. So that way the doc can know right away if you're going to be able to do the sealants that day. This is a space, to write down anything urgent. So if you see decay, you see perio, you see infection, or you just think so. One thing I really want to hit hard here is that, as a hygienist, you're not supposed to diagnose. But by golly, you sure do know a lot. So this is a good spot, that if you see decay, and this is a spot that I want you hopefully to write down things that you've talked with the patient about. So if you see on the x-ray, hey, that's decay, or hey, Mrs. Jones, this looks like there might be a cavity starting here. Don't know what the doc may want to do, but it might be, a filling or something like that, or it might be too small that he may not want to do anything at all. But this is something that he's going to probably want to look at. Anytime you have that type of conversation, that hopefully should be written down here. This is another good spot for perio. Hey, I see on these X-rays we see interproximal calculus. A lot of things, we may have to do a deeper cleaning. This is the readings I'm finding. I'm kind of seeing that the probe depths are deeper, et cetera, et cetera. The doc may want to look at that. So anything that you can see here, any periapical lesions, anytime you have the conversation of, hey, this is something going on, I'm going to let the doctor know this is a good spot to write that down. And then if there's anything preventative, if there's any type of fillings that are breaking that need to be replaced, if the patient's grinding and you've talked to them about a night guard, this is a great place to write it down. Or if they talk about their TMJ issues or anything, this is a great place to write them down. Or anything preventative like such as sealants or fluoride of that nature, you can write that down that the patient's interested in that. Another thing that we can look at too is anything cosmetic. If the patient talked about whitening and they're interested in doing something like that, great place to circle that or write something down here. This is 6 month smiles. That's what the 6MS stands for. And then there's restorative. Another thing that we could write in here is Invisalign. Anything that the patient's interested in for, and we also have ortho up here. Just anything cosmetic. This is a good place to write that down. And then patient skepticism or desire. Like patient thinks fluoride is the number one poison in the world, or they don't want to have any x-rays taken. This is a great place to be able to write that down. Or a patient wants to be able to do his cleaning in 2 different visits because it's taking a long time. Just anything that is out of the ordinary, you can write in there. So hopefully this gives us a really good interview. It takes 2 seconds to fill out, and preferably how the hygiene appointment goes is hygienist sees the patient, or seats the patient, fills out all of this information, does all of the exam first, and then fills out this, talks to the patient. So you're going to spend the first 10 to 15 minutes with the patient, explaining, talking to them, getting to know them, writing down anything urgent, anything preventative, cosmetic, or any skepticism they have. So you'll write all that down, and then before you even start doing the scaling and the doing the prophy, you'll take this exam sheet and you'll go give it to the dentist. And you'll say, hey doc, this is ready to go whenever you are. Because oftentimes the doctor's schedule and the hygienist schedule doesn't line up right at the very end of the cleaning. Ideally, in an ideal world, that's how we would do every exam. The patient's completely clean. The dentist comes in and we see the patient at that time, and then we go on. But oftentimes, right at the very end of the exam, we're in the middle of a filling, a root canal, etc., where it's hard to break away. The patient ends up waiting 5 to 10 minutes. Then we do the exam, and then they leave. So the patient ends up having an issue with waiting, and then sometimes the hygienist schedule can get off. So this sheet kind of helps, and this system kind of helps out with that. So once you've done the exam, and once the hygienist has done the exam, this is filled out. You take it to the doc, whatever operatory he's in, or a designated area, and you say, hey doc, Susie's ready for an exam. And then you just put it down. And then you go and you start your cleaning. That way the doc can kind of calculate in his mind, all right, I probably have some time in the next half an hour. I need to make sure that I get over there and do the exam. And then the doc can have flexibility with being able to do, finish the root canal, finish the filling, maybe finish the prep, and then in between the prep and filling, give the patient a break and go do the exam there. And then that way, when they pop in, as a hygienist, you can say, all right, doc's here, he's going to do the exam, he's going to get really busy, so we don't want to make you wait. So he's going to do the exam now until I'm done with the cleaning. And so that way you can come in, he or she can come in, do the exam, make sure everything's good. And then once you're done treatment planning and going through everything, this also gives you time to reinforce kind of what the doctors talked about, etc. Most of the time we wait till the end of the cleaning, but if we can't, this is a good system for that. So hopefully that makes sense. It's a great tool. I think you'll really appreciate it once you start using it. I know it's kind of a little bit of a pain to fill out, but it ends up being a great system once you kind of get used to it.